Roughly 40% of physician assistants who have treated COVID-19 patients say they've had to go without adequate personal protective equipment, according to a new survey from the American Academy of Physician Assistants. There are more than 140,000 physician assistants in the U.S. who work in all medical settings and specialties. According to a sample of those frontline workers, furloughs, layoffs, and access to personal protective equipment are their top concerns. And the AAPA says it's the Academy's duty to advocate for them.
What this showed was that we have to protect our frontline healthcare workers.
Jennifer Orozco, who is on the AAPA's board of directors, said the most urgent concern is personal protective equipment. Beyond having enough for COVID-19, she says healthcare providers still need PPE for other infectious diseases that they've always had to face. The survey also found over the last 10 months, roughly 16% of physician assistants have changed specialties or practice settings to help where they're needed most. Orozco, who's in charge of redirecting those physician assistants, says outdated restrictions are the reason the survey found 22% of physician assistants furloughed and forced on the sidelines.
And here we are, we have a quarter of the workforce almost sitting at home because of restrictions that are in place that don't allow them to take care of frontline patients. And we cannot afford a quarter of 140,000 plus people to be sitting at home when they need to be out there taking care of patients.
21 states have already waived at least some of those requirements, but the AAPA says more states must ease these practice restrictions so that PAs can fully contribute to the COVID-19 response.
So not only PPE issues, but practice issues and furloughed and, restrictions by state law, all of these challenges that these essential frontline providers have had, and it's really concerning. And so what we knew pre-COVID, I think, of the healthcare system is gone. And we're going to enter, one thing's for certain, we're getting into a whole new healthcare system, and it's going to be very interesting what it looks like going forward. And going forward 6 months from now and going forward years from now.
For Newsy, I'm Johanna Grenaway.